Assalamu alaikum warahmatullahi wabarakatuh. Let us start to take diseases of contact infection. I am Salwa Adlam, Assistant Professor of Public Health and Community Medicine, Tanta University. This lecture is needed for Pediatric Chest Tropical Public Health Semester 3. The lecture composed of a short overview of infectious diseases, and we will discuss the tetanus, anthrax, gas gangrene, and rabies. What are infectious diseases means? They are a group of diseases caused by an infectious agent. What are the infectious agents you know? It may be viruses, bacteria, parasites, and so on. What happens with infection? If there is an organism and there is a susceptible host with no immunity or weak immune system as a result of disease, chronic diseases, or taking drugs like cytotoxic drugs or corticosteroids, the organism pass into the body of the host, and after an incubation period which differ according to the type of organism and the type of the disease, the manifestation of an infectious disease start to appear, either mild or severe according to many factors, for example, pathogenicity of the organism, the condition of the immune system, and so on. The infectious diseases can be classified according to many methods. One of the most important methods is the infectious disease classification according to mode of transmission. We have either direct transmission or indirect transmission, and contact infection or disease of contact infection is one of the methods of transmission of infectious diseases or one of the methods of classification of infectious diseases. Disease may be acquired due to person-to-person transmission, and in this condition it is called the communicable disease, or zoonotic diseases, that is to say transmission of infection from animal to human, or arthropod-borne disease, that is say transmission of infection via arthropod like ticks, mosquitoes, fleas, etc., or as a result of behavioral risk factor or lifestyle factor, example work, culture, personal choices. This is the chain of infection composed of causative agent, a reservoir of infection, either human or animal or inanimate surfaces, portal of exit, the method from which the organism find way outside the reservoir is blood, intestinal tract, respiratory tract, skin or mucous membrane, and the mode of transmission is the way by which the organism passes from the reservoir to the new host, and the portal of entry is the mean by which the organism passes to the body of the new host, and the host Let us start with the first disease of contact infection today, which is the lockjaw or tetanus. Tetanus is the only vaccine preventable disease that is not communicable. And here I want to ask you a question. Is the infectious disease must be communicable? Or is there a difference between communicable and infectious disease? Actually, yes, they are not synonyms. Communicable disease is one of the infectious diseases which can be transmitted from person to person. Tetanus is not a communicable disease, but it is an infectious disease. Why it is not a communicable disease? Because it is not transmitted from person to person. How it can be transmitted? Let us take the lecture and we will know. The causative agent is everywhere. The disease has a high case fatality rate and through immunization almost completely prevented. Following the introduction and widespread use of tetanus toxoid, a safe and effective vaccine, tetanus has become uncommon in developed countries. Nonetheless, it remains common in developing countries, particularly among neonates. Tetanus is a form of wound infection characterized by acute intoxication that involves the nervous system. The toxin doesn't cross the blood-brain barrier and can spread and reach through the central nervous system by retrograde intra-axonal transport from axon to axon of the peripheral nerves. Why tetanus infection doesn't confer immunity? The quantity of toxin sufficient to cause disease is generally insufficient to induce an immune response. يعني مش معنى ان حد جاله تيتانس في يوم من الايام وعدى منه انه ده هيديله life long immunity. No. So لازم ناخد الفاكسين واحنا صغيرين according to expected expanded program of immunization. وبيكفر مدة معينة وبعد كده احنا لما حد بيجي يتعرض لموقف ممكن يؤدي إلى الإصابة بالتيتانوس بنسأله انت آخر مرة خدت الفاكسين امتى إذا كان أكتر من 10 سنين وكانت جرعاته كاملة والجرح كان مش نظيف والمكان ما كانش نظيف بنرجع نديله الفاكسين تاني upon exposure. So, infection with tetanus is not sufficient to cause immunity against the reinfection. The causative agent is the neurotoxin or the exotoxin produced by the bacteria Clostridium tetani. Reservoir of infection, horses and other herbivorous animals mainly, and occasionally men. Tetanus Bacillus is found in two forms. Vegetative form is a normal inhabitant of the intestine where it finds exit with feces. On leaving the body, the reservoir, it sporulates or forms spores outside the body at once to contaminate the soil with tetanus spores, which are highly resistant to the environmental factors, especially desiccation. Desiccation معناها dryness. So spores persist for years. How can the organism transmit it to human? Through contamination of wound with tetanus spores in different occasions. Either injury in a polluted place, for example أو الcommon قوي إن حد يجي يقول لك أنا دخل في رجلي مسمار والمسمار كمان يقول لك كان مصدي أو كان في الأرض أو المكان ما كانش نضيف. أو لو في مثلا كراش انجري وفي تمزق في الجلد وتمزق في العضلات والكلام ده واتخبط في وقت الحادثة مثلا بحاجات مش نظيفة يبقى متوقع إنه لازم نعمل vaccination against التيتانوس. أو الأذر مود زي neonatal infection contamination of the umbilical stump with tetanus spores on cutting the cord with contaminated instrument or dressing the stump with contaminated material causing tetanus neonatal. أو بقى الحالة الثالثة اللي هي في غرف العمليات أو أثناء العمليات أو post operative. Tetanus is a form of hospital infection. It may occur through using improperly sterilized catgut, contamination of wound due to unclean hospital environment, أو reactivation of dormant tetanus spores in contaminated old wound. أو في حالات البيربرال sepsis أو البيربرال infection by using non-sterile instruments especially after septic abortion. Certain breaks in the skin that are more likely to get infected with tetanus bacteria. These include wounds contaminated with dirt, feces, or saliva, wounds caused by an object puncturing the skin like a nail or needle, burns, crush injuries, injuries with dead tissues. The incubation period usually 3 to 21 days, average 10 days, although it may range from 1 day to several months, depending on the kind of wound. Most cases occur within 14 days. In general, shorter incubation periods are seen with more heavily contaminated ones. Spores are activated into the vegetative form and secrete an exotoxin which invades the blood producing toxemia affecting mainly nervous system, the motor nerve endings and anterior horn cells of spinal cord and brainstem. وبالتالي الكيميكال ترانسميترز اللي بتطلع تنهبت الكونتراكشن اوف muscles هتبطل تطلع فهيبقى في حالة continuous contraction of the muscles وطبعا ده بيبقى painful وما يعمل fatigue للعضلات. So the manifestation appear in the form of severe tonic spasm of muscles, first appearing around the wound, then masseter muscles causing lockjaw فيبدو المريض كما لو كان مبتسم أو بيقولوا عليه الكزاز كما لو كان بيكز على أسنانه. والنك muscles طبعا بتعمل stiffness و other parts of the body are affected وبتديني لو هو في الأطفال حاجة اسمها الأوبستونس position أو الأرشد باك. قلنا قبل كده إن الديزيز ده highly fatal. Untreated cases show high case-fatality due to heart and respiratory failure or asphyxia from constriction of chest muscles. هي contraction مش constriction. This is the obesotonous position and this is the الكزاز أو lock jaw appearance. Now it is a preventable disease. How can we prevent the tetanus? The general preventive measures in the form of community development and environmental sanitation, segregations of stables and animal sheds from residential areas, the specific prevention in the form of active immunization, tetanus toxoid either by itself or in the form of DBT اللي هي tetanus وpertussis والdiphtheria or DT for infants and older children DT and at-risk groups of adults. Seroprophylaxis tetanus antitoxin أو anti-tetanic serum derived from equine اللي هي الهورسز giving 1,500 international unit intramuscular as soon as possible after suspected injuries or bigger dose if delayed. It is protective for around 2 weeks. Precautions must be taken to avoid the risk of serum reactions. The human antitoxic immunoglobulins طبعا better. Specific immunoglobulin given in a dose of 250 units intramuscular. It is protective for 2 to 3 months. بتدي وقاية أو حماية لمدة 3 شهور. الكيم prophylaxis penicillin prophylaxis. Penicillin can be given in place of seroprophylaxis if the wound is properly cleaned. الكير اوف wounds طبعا واحد من ال preventive measures aseptic cleaning and removing any foreign matter and necrotic tissue as early as possible. Prevention of other forms of tetanus regarding neonatal tetanus, aseptic cutting of the cord, care of umbilical stump using sterile dressing, active immunization of mothers in 5 doses given in 1 pregnancy or in sequential pregnancies. Surgical infection, clean hospital environment and surrounding area, asepsis and sterilization throughout all procedures, precise manufacture of sterile catgut, care and protection of wounds. A puerperal infection can be prevented through asepsis and sterilization in labor or abortion, active immunization of pregnant women in high-risk areas, chemoprophylaxis after labor or abortion. بيجي سؤال بقى frequently asked how soon should I get the tetanus shot after injury يعني الوقت يمر قد ايه بعد قد ايه ممكن ان انا اخد الفاكسين او التيتانوس شوت ديت ويعمل لي protection. Although tetanus causing bacteria needs 3 days to incubate and release the toxin to your blood, you don't have to wait for that long. مش لازم ابدا استنى 3 ايام اللي هما ال72 ساعة. أمال أعمل إيه؟ soon after you get wounded try to recall the last time you get a shot of tetanus. آخر مرة خدنا الفاكسين فيها كانت إمتى؟ Tetanus vaccine should be given when you are young and repeated once every 10 years. المفروض إن إحنا وإحنا صغيرين كلنا خدنا التطعيم. المفروض إنه بيدي حماية لمدة 10 سنين، يكرر بعديها كل 10 سنين. When you step on a rusty nail and haven't got the shot in the last 5 years, you need to go to the hospital within 24 hours to get the shot. If you had got the shot within the last 5 years and the wound is not deep and severe, you can take your time to see whether you have the tetanus symptoms. One thing to remember is that the size of the wound will not determine the risk of catching tetanus. يبقى خلاصة الكلام ده إنه لازم الواحد ما يستناش، يفتكر آخر مرة خد التيتانوس، حقنة التيتانوس دي كانت إمتى. إذا كانت من أكتر من 10 سنين يبقى لازم على طول أروح أخد الحقنة. إذا كانت من أقل من 10 سنين within مثلا 5 years وأنا خدت ال3 جرعات كلها مظبوطة بتاعة التيتانوس أو خدت الجرعة كاملة، يبقى كده مفيش داعي إن أنا آخد الفاكسين. Now let us discuss the control of tetanus. Early case finding, this is most important measure of prevention. So, if there is an infection in certain hospital or puerperal infection, puerperal sepsis in the same hospital or tetanus toxoid في hospital, we must notify local health office إنه كان في عندنا حالة تيتانوس يا جماعة في المستشفى الفلانية أو في غرفة العمليات الفلانية. في الحالة دي هنعمل إيه؟ بنعالج بقى الحالات surgical care of wounds، بندي سيروثيرابي أو بندي الكيموثيرابي بنسلين أو تتراسايكلين to control local tetanus bacilli and prevent and control bacterial complications. أو بنعمل بقى epidemic investigation علشان نشوف سبب العدوى دي جاي منين أو مصدر العدوى جاي منين for cases of hospital and the neonatal infection especially when repeatedly reported. The second disease we will discuss today is the gas gangrene. And I want to ask you, what is the difference between dry gangrene and wet gangrene and gas gangrene? That's say I want to say there is 3 types of gangrene: dry, wet, and gas. Dry gangrene occurs when one of your body part isn't getting enough oxygen. Eventually, body part will start to deteriorate and die. With dry gangrene, the skin is closed and there is no evidence of infection. Wet gangrene, the tissue reacts to the presence of the bacteria by growing moist and breaking down. This process causes the death of your tissue. It's more of an emergency than dry gangrene because of the possibility of infection spreading to other parts of the body. Gas gangrene, bacteria called Clostridia cause gas gangrene. These bacteria creates an infection that causes gas bubbles and toxins to develop inside the affected area. The resulting gases cause tissue death. This type of gangrene can be fatal, although it's rare in the United States. May occur. Gas gangrene, sometimes called clostridial myonecrosis أو gangrenous emphysema، وهنعرف هما مسميينها كده ليه. It's a life-threatening, rapidly progressive, necrotizing, gas-producing infection of skeletal muscles due to invasive anaerobic clostridial infection. Causative organisms, anaerobic spore-forming Clostridia. There is primary organism, Clostridium welchii أو Clostridium edemathias. Secondary invaders, Clostridium histolyticum أو sporogenes and others. They are proteolytic. يبقى الأولانية البرايمري سكاروlytic and toxigenic وتعمل toxins، والتانية proteolytics بتكسر البروتين. A reservoir of infection, animals and man. The organisms are inhabitants of the intestine and find exit in excreta and sporulates. Spores contaminate the soil and persists for long time. How gangrene occurs or how gas produced. Uh, the organism uh, spore forming in the environment introduced into the body and transformed into vegetative cells which multiply, form carbohydrates through fermentation. Fermentation produced gases, gas production inside the tissues, resulting in distension of these tissues, which interfere with blood supply, resulting in ischemia and gangrene, with death of the tissues by toxemia. This must occur in an aerobic condition. How can the organism pass to the body? Through contamination of deep lacerated wounds with spores of Clostridium bacteria that under anaerobic conditions produce toxins which cause tissue death and associated symptoms. What are the risk factors or the associations which may lead to gas gangrene? Severe road, occupational, and war injuries. Infection is favored by laceration and damage of muscles, interruption of blood supply, and the presence of foreign matter. Puerperal infection. Infection may occasionally be introduced into the uterus on septic abortion. Our surgical infection postoperative cases have been reported possibly through deficient sterilization of contaminated skin and instruments and fomites. What are the symptoms and signs or the clinical picture? Locally, cellulitis and myonecrosis, that's the destruction of tissues and the muscles with production of gas, toxemia by the exotoxin secreted by local. This is the clinical picture where gases is formed and manifested by bully full of air or gases, and this is the characteristic color of gangrene. How can we prevent the gas gangrene? Through surgical care of injuries. The earlier the better. Any foreign matter should be removed and the damaged tissues excised. Asepsis during surgery, preoperative preparation of the skin, especially of buttocks and thighs, and proper chemoprophylaxis. Prevention of puerperal infection, obstetric care, and emergency care of abortion. How can we prevent gas gangrene specifically? Through using seroprophylaxis by polyvalent antitoxin, intramuscular, and chemoprophylaxis by penicillin. How can we control the condition? Cases by early case finding, the earlier the better, surgical management, specific therapy, massive doses of penicillin, the main therapy, and the serotherapy in proper dosage. Drastic measures which can be taken if there is a condition in a hospital. When a case appears in hospital ward or outpatient clinic, work is stopped in involved place, which is closed. Sterilization of anything that may be contaminated. Sterilization of the place, especially operating theater by formaldehyde gas. Protection of at-risk cases when suspected to be exposed to infection in ward, clinic, or operating theater by both seroprophylaxis and penicillin chemoprophylaxis. There is another disease of contact infection, which is a famous one called anthrax. Anthrax is a life-threatening infectious disease that normally affects animals, so it is called zoonotic disease, especially goats, cattle, sheep, and horses that may rarely infect man. It can be transmitted to humans by contact with infected animals or their products. In recent years, anthrax has received a great deal of attention as it can also be spread by a bioterrorist attacks or by biological warfare. So it may be zoonotic disease or occupational disease or used in bioterrorism. Causative organism Bacillus anthrax أو anthrax bacillus which is anaerobic. المرة دي aerobic، المرتين اللي فاتوا كانت anaerobic يعني بتحتاج anaerobic يعني بتحتاج لعدم وجود الأكسجين بتاع الهواء الجوي عشان تكمل نشاطها، لكن في حالة الانثراكس اتس aerobic يعني ممكن في الهواء العادي تشتغل وتعمل السبور. Spores are highly resistant and remain viable in contaminated soil and material wool, hair, hides for years. وهنا برضو هي resistant desiccation. يعني ايه desiccation؟ قلنا قبل كده يعني ان هي تنشف، تبقى ناشفة أو dryness. عشان كده هم استعملوها في الإرهاب، إنه كانوا بيحولوها على هيئة باودر ويحطوها في أظرف ويبعتوها كجوابات للأماكن اللي فيها جنود أو whatever. مجرد ما يفتح الجواب البودرة بتاعة الباودر اللي فيها السبورز بتنهيلد وتروح على الريسبيراتوري سيستم وتعمل النيمونيك أنثراكس which is the severest form. Reservoir of infection. Farm animals, mainly sheep and cattle. The organisms are found in the intestine, blood, and organs and sporulate on leaving the body. Incubation period from 1 to 7 days. In man, anthrax occur by exposure to infection through occupational as farmers, butchers, vets, other workers exposed to infection on contact with diseased animals or handling infected tissues and materials. Non-occupational infection using unsterilized shaving brushes made of natural bristles. There are three forms of anthrax. Cutaneous anthrax affects skin, digestive anthrax affecting GIT, or pneumonic anthrax affect respiratory system. Cutaneous anthrax or malignant pustule, it is the commonest form of anthrax in man. A characteristic skin lesion occurs at the site of infection like a boil that forms an ulcer with a black center. Cutaneous anthrax is rarely fatal if treated. Without treatment, about 20% of cutaneous skin infection cases progress to toxemia and death. Intestinal anthrax caused by ingestion of contaminated milk or insufficiently cooked meat of diseased animal. The case suffers of severe gastroenteritis with high case fatality, estimated to be 25% to 60%. Respiratory anthrax or pneumonic anthrax, usually occupational infection due to inhalation of anthrax spores with dust of contaminated raw wool during the process of wool sorting in industry, hence the name wool sorters disease. Other practices associated with exposure include slicing up of animal horns for the manufacture of buttons, handling of hair bristles used for the manufacturing of brushes, and the handling of animal skin. This mode of infection is used as a bioweapon. Contact of pneumonic cases are exposed to droplet infection. The pneumonic cases show severe hemorrhagic bronchopneumonia and septicemia which is invariably fatal. ونخلي بالنا ان احنا قلنا انهم disease of contact infection non communicable disease. هنا exception بقى، هنا communicable disease اهو ظهر اللي هو respiratory anthrax أو pneumonic anthrax can be transmitted from one person to another person. عشان كده اللي استخدموه في الإرهاب قالوا نعملها بودرة ونحطها لهم عشان واحد بس هيستنشقها هيجيله الأنثراكس، ويعدي بقى الناس التانيين اللي in contact معاه. How can we prevent anthrax? Measure should be taken to animals and measures to human. طبعا اللي هيهمنا الهيومن، بس عشان نحمي الهيومن لازم برضو نعمل measures في الانيمالز. Sanitary clean environment, vet care and vaccination, isolation of diseased animals and disinfection of discharge. Carcass of dead animal must never be opened to prevent sporulation of anthrax bacilli, but incinerated or buried in deep pits and covered with quicklime. In human, milk and meat sanitation, disinfection of raw wool and hair in special stations in certain countries by formalin before being used in industry, quarantine measures for imported raw wool and hair, and shaving brushes made of natural bristles. Approved certificate is required, otherwise not allowed into the country. Protection of workers against occupational infection, protective clothing and gloves, and washing facilities. Regarding vaccine, anthrax vaccine from a product of the bacteria is used in USA for protection of their military personnel only. Control case finding, early case finding, and followed by notification, isolation, disinfection, and penicillin chemotherapy. Contact of pneumonic cases, isolation for 7 days. Epidemic measure, search for reservoir and channels of infection. Rabies, sometimes called hydrophobia، وهنعرف ليه دلوقتي. Rabies is a fatal zoonotic disease caused by rabies virus. كلهم كانوا بكتيريا وده الوحيد الفيرال which is a member of the genus Lisa virus of the family Rhabdoviridae or bullet-shaped viruses. The virus attacks the central nervous system, causing progressive paralysis, encephalitis, and coma. Once symptoms are present, rabies is a fatal infection. Rabies is present on all continents. في كل قارات العالم موجود with the exception of Antarctica and endemic in Africa, Asia and Latin America, but more than 95% of human deaths occur in Asia. This is the map بتوضح إنه موجود بنسبة عالية جدا في آسيا وأوروبا وإفريقيا، وبيقول إنه موجود بنسب عالية برضو في جنوب شرق آسيا. Reservoir of infection, domestic and wild animals. Dog is the most important. بس الناس كلها معتقدة إن بس الكلاب هي اللي ممكن تنقل الريبز، بالعكس ممكن كل الدوميستيك أنيمالز زي الكات تيجي بعد الكلاب، وبعدين الفوكس والولف والأذر أنيمالز اللي موجودين outside the house. المشكلة بقى في الفامباير بات، لأن الفامباير كل الأنيمالز دي وانس جالهم ريبز ممكن يموتوا من المرض، لكن الفامباير بات أو اللي هو الوطواط مصاص الدماء ده found in some countries but not Egypt الحمد لله is important reservoir، لأنه لما بيبقى affected بالفيروس هو ما بيموتش، بيفضل عايش ويبقى remain infective for months. Modes of infection. Bite of rabid animal is the usual mode of infection and the lick occasionally. The virus is present in the saliva of the rabid animal. The risk of human infection depends on whether single or multiple bites, extent and severity of bites, site of bites from the head، يعني كل ما يبعد الوند عن الهيد كل ما يبقى أقل خطورة، ولما يقرب يبقى أكثر خطورة. whether the skin was bare or covered. Incubation period typically 1 to 3 months but may vary from أقل من أسبوع لأكتر من سنة. Clinical picture. The initial symptoms are fever and often pain or an unusual or unexplained tingling, pricking or burning sensation, paresthesia at the wound site. As the virus spread، يعني ده في الأول، بعد كده لما ينتشر الفيروس through the central nervous system بيحصل fatal inflammation of the brain and the spinal cord develops. الفيتال انفلاميشن ده بقى بيؤدي إلى إيه؟ بيظهر عندي شكلين من الأعراض، يا إما people with furious rabies exhibit signs of hyperactivity, excited behavior، وهيدروفوبيا، أي مجرد ما يشوف منظر المية يحصل له attacks of convulsions and sometimes aerophobia، حتى مجرد ما الهواء تيار هواء يعدي من قدامه، وبعد few days this occurs by cardiorespiratory arrest. أو الباراليتيك فورم about 30% من الحالات the muscle gradually become paralyzed starting at the site of the bite or scratch وبعدين البيشنت يدخل في كوما ويموت في الآخر. البريفنشن، how can we prevent measures for animals destruction of stray dogs. الكلاب اللي في الشوارع ديت بيلموها ويموتوها بطريقة أو بأخرى، أو بنعمل mass vaccination of dogs by inactivated rabies vaccine and giving license. ده لو كنت هاخده أقتنيه في المنزل يبقى domestic animal لازم يكون عنده تطعيم أو متطعم سواء كان كلب أو قطة بقى whatever. quarantine of imported dogs، إذا احنا هنستورد كلاب من أي مكان يبقى لازم يجي معاه شهادة إنه ما عندوش ريبز أو إنه متطعم ضد الريبز. measures for men في pre-exposure immunization وفي post-exposure prevention. pre-exposure immunization for at-risk groups زي الفيتس وزي الزو workers ونايت جاردز and particular lab workers، ممكن دول نديهم الفاكسين كوقاية pre-exposure. إنما في جميع الحالات الأخرى إحنا بندي الفاكسين بوست اكسبوجر، وده حالة خاصة من حالات الفاكسينز. كل الفاكسينز بديها بري اكسبوجر، لكن هنا في حالة الريبس إحنا بنديه بوست اكسبوجر اون اكسبوجر تو انيمال بايت على طول بسرعة as early as possible، وأقدر أروح أخد الفاكسين. وبنعمل إيه؟ بنعمل الأول تطهير لمكان الوند، ونخلي بالنا ممنوع منعا باتا أطهر بكحول مية وصابون فقط، لأنه الكحول والحاجات التانية ممكن تعمل irritation للنيرفس اللي موجودة في الاريا وتزيد الطين بلة. وما نخيطش طبعا عشان لو في أي discharge بيخرج. تيتانوس سيرو بروفيلاكسيس أو بوستر توكسويد أند كيم بروفيلاكسيس، ممكن ساعات نحط كمان أنتي بوديز على مكان الجرح علشان نساعد شوية إن احنا نقتل الأورجانيزم قبل ما ينتشر عن طريق السنترال النيرفس سيستم. ممكن أدي كمان تيتانوس فاكسين في حالة مع الريبس فاكسين إذا كان الأنيمال اللي حصل معاه العضة ده كان في الشارع أو كده وإحنا مش ضامنين إن الوند يكون اتلوث أو whatever. ممكن ندي الفاكسين وندي كمان سيرو بروفيلاكسيس للبيشنت. يبقى إيه هي الإنديكيشنز أوف immunization؟ لو الأنيمال escaped immunization must started at once. لو الأنيمال died أو killed and the laboratory examination of the brain shows negri bodies, the animal is alive and put under observation for 10 days in a special center and start vaccination when the animal dies within this period. Multiple bites in the head and the neck، أو لو الانيمال حبسناه ولاحظناه 10 ايام ولقيناه مات يبقى هنكمل الفاكسينيشن زي ما احنا كنا متعودين. لو الانيمال عاش وما حصلوش اي حاجه يبقى معناته ان هو مش رابد انيمال اصلا وبوقف الفاكسين. طب ايه هي انواع الفاكسين اللي موجوده؟ في 4 انواع مشهورين قوي: الهيومن ديبلويد سيل فاكسين، والبيوريفايد تشيك امبريو سيل ريبيز فاكسين، والريبيز فاكسين ادزوربد او بيسموه الار في اي. طيب هما بيختلفوا ليه 3 أنواع سوري مش 4؟ طب هما يعني according to what؟ هو على حسب طريقة التصنيع وعلى حسب الشركة المتعاونة. وفي فاكسين كان موجود زمان وكان بيتاخد انترابريتونيال أو 21 حقنة والكلام ده ما بقاش موجود دلوقتي. اللي بيستخدم على هيئة 5 جرعات 1 ملي each intramuscular في الدلتويد اريا في الأيام 0 و3 و7 و14، يعني وقت البني آدم يتعض اللي هو 0، وبعدين بعد 3 أيام، وبعدين في اليوم السابع، وبعدين في اليوم ال14، وآخر جرعة هتبقى في اليوم ال28. يبقى هما كده 5 جرعات. طب إيه البروفيلاكسس كمان بنستعمله؟ بنستعمل الهيومن ريبيز immunoglobulin at the bite site to neutralize the virus till vaccine work. Thank you, and I hope it will be a short lecture and beneficial. Thank you.